Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Welcome to the show, everyone. Today is episode number 15, Klinghardt Conversations with my very special guest, Dr. Dietrich Klinghardt. Dr. Klinghardt studied medicine and psychology in Freiburg, Germany, completing his PhD on the involvement of the autonomic nervous system in autoimmune disorders. Early in his career, he became interested in the sequelae of chronic toxicity, especially lead, mercury, environmental pollutants, and electromagnetic fields, and its impact on chronic illness. While working in India, he encountered Eastern concepts of disease etiology and blended them with his Western training. This laid the foundation for his 5-level system of integrative medicine known as the 5 levels of healing. Increasingly aware of the limitations of conventional medicine when dealing with chronic conditions, Dr. Klinghardt expanded the focus of his work to include body-oriented psychotherapeutic approaches such as applied psychoneurobiology, family constellation work, and other tools. Dr. Klinghardt has contributed significantly to the understanding of metal toxicity and its connection with chronic infections, illness, and pain. He has been instrumental in advancing various fields within biological medicine, such as non-invasive pain management, injection techniques for pain and orthopedic dysfunction, anti-aging medicine, toxicology, neuro-developmental disorders, energy psychology, biological dentistry, and more. He's also developed Autonomic Response Testing, a comprehensive evaluation system that has helped many practitioners to become accomplished holistic practitioners. He founded Sophia Health Institute in 2012 and is actively involved in patient care at his clinic outside of Seattle, Washington. On a personal note, I have tremendous gratitude for Dr. Klinghardt and for his work. Dr. Klinghardt was my personal doctor for several years and provided me with the information and tools to become empowered to improve my health. I will be forever grateful. And now here's my interview with Dr. Dietrich Klinghardt. All right, Dr. Klinghardt, thank you for being here today. I really appreciate it and have a lot of interesting questions, hopefully, to discuss. So thanks for being on the show.
Thanks, Scott.
All right, so for those who don't know your personal connection to Lyme and chronic illness, can you share a little in terms of how Lyme has impacted you personally?
Yes. I grew up in southern Germany. I grew up in Berlin, but when I was 12, we moved to southern Germany. My mother got very ill, didn't recover until I diagnosed her when she was about 70. So this is about 50 years later. And I got unstable with my health, let's put it that way. And then had a number of health challenges, very, very severe one in my 20s. Went to India, recovered, moved pretty much soon after that to America, and was doing quite well, and then relapsed when I was in my 30s, mid-30s, and then around when I was 41, in 1991, diagnosed myself with Lyme, treated myself, and have been in pretty good, decent health since then. And so I think I've lived through all the stages of Lyme disease, the despair, the phase of the joint pain, so chronic fatigue, the floaters in the eyes, the vibration in the spinal cord and brain. I lived through all those stages and managed to hide it pretty well from the society around me, but basically really didn't start life until I was maybe in my mid-50s, and really lost 30, 40 years of my life, to this illness, just basically faking my way through it. And so I'm trying to make up for it now.
Wow. Well, the one thing I would say you probably never did have, at least from what we can observe, is brain fog, because your brain certainly seems to be working quite well.
Well, no, believe me, I know I had my share of that. Yeah, and so, but fortunately, I work in a job as a medical doctor where intelligence is not that common, and so nobody noticed because I was in a field, where the general IQ is not that high, and I have a pretty good IQ, and a good IQ with a lot of brain fog still looks, decent.
Okay, so let's talk a little about EMFs. I think most people are familiar with your recommendations for EMFs, no cordless phones, minimizing cell phones, turning off Wi-Fi, turning off the fuses at nights, and then things like the Stetzer filters and the sleep canopy. And I know with the introduction of 5G this year, I've heard neurosurgeon Jack Kruse suggest that things will get much worse relative to the direct impact on the mitochondria. And so what I'm interested in is your thoughts around how do we step up our EMF protection game even further, and how do we become more resilient in the face of this ever-increasing EMF threat?
Yeah, I think in terms of the protection on the outside, the graphite paint and the clothing and the things you just mentioned, I think we pretty much already reached the maximum what we can do in that regard. And so it really now is about the internal protection. How can we protect ourselves internally? So in the literature are a few things. One is going to sleep with a pretty high dose of melatonin, but that's not enough. In the middle of the day, and this is fairly new, this research, the microbiome in the gut requires a high level of melatonin. It's exactly opposite of our own rhythms. The microbiome in us has a rhythm where the main melatonin consumption and need is in the middle of the day. So we get people used to taking pretty good dose of melatonin at night and about half of that in the middle of the day. That's number one. Second one is rosemary. We use rosemary tincture. Rosemary has been shown to be enormously radioprotective, and this is not only towards gamma rays and X-rays, but also towards the radio waves from the cell phone radiation. The third item is propolis. Propolis contains CAPE, C-A-P-E. The PE stands for phenyl esters, and they're inducing a melatonin-like protective effect in the central nervous system after absorption. And so we use from BioPure, we use the rosemary tincture, propolis tincture, really round the clock as much as we can. People have to wear the protective clothing, and we do the melatonin. That's number one. Number two is that we found now a number of people, when we put them on a fairly high dose of methylated folate, that after about 6 months, they start noticing a much increased tolerance towards electric fields and magnetic fields, and towards the Wi-Fi router and the cell phone. And that reaches a maximum protective level after about 1 year. But we're talking doses of about 20 milligrams a day, not the 2 milligrams or 0.5 milligrams, but 20 milligrams a day. And to make that safe, it needs to be complemented with a pretty high dose of niacin. Not no flash niacin, real niacin, vitamin B3. And so what we do, we tiptoe our way up in this way. People need to tolerate 1,000 milligrams of niacin 3 times a day. If they have a severe flush or other vascular sort of things itching on the skin that's unbearable, they need to go up with the folate. And so we're actually dosing the folate by their niacin tolerance. And it has been wonderful to see the true effect. The trouble with the methylated folate is it is totally contraindicated in Epstein-Barr-related cancers. These are the cancers of the throat and mouth, breast cancer, stomach cancers, esophageal cancers. these are rapidly growing cancers, and methylated folate unfortunately puts fire onto those cancers. So there is that limit that is a conflict that's difficult to juggle. And maybe last words is that it's important for people to know that the radiation damage from microwave, but also from other man-made sources, is cumulative. That means wherever people can reduce, it is helpful. So if you can use your cell phone only as a texting option and have a landline available where you actually make your phone calls, if you can switch off the fuses at night, if you do any protection that we recommend and reduce the overall radiation you're exposed to, you're already winning. And so with the 5G, the worst thing in the last few years really was the low frequency radiation used by the police and by the fire engines and by the hospitals and the ambulances. That's 400,000 hertz. That was deadly. It goes right through the walls, no matter how much concrete. And people living close to those stations, they all got deadly ill. And so the 5G, we need to see, because nobody really has looked truly at the biological effects. I think these, my opinion, I think these wavelengths are chosen intentionally for human degeneration. It cannot be any other way, because there's other windows, biological windows of wavelengths where it would be totally safe, but they are not used. The windows that are exactly used are the ones that are known to cause the most illness, the most destruction. And so we need to see where that goes. I'm not having my hopes too high.
So I think that's lots of good options for people. I mean, the reality is I think many people haven't even implemented the basic EMF protection things that you talk about. So I think many things there for people to explore. I know another focus of your work is parasites, and I'm wondering if you're still finding that the pharmaceuticals are winning out over the natural options, and what are some of your more favorite options for addressing parasites at present?
Yeah, last year I wrote a book and published a book. It's in German. It will be in English eventually. And my co-writer, Ariane, found this very impressive, very, very good, well-published paper where a parasitologist reflects very honestly on the use of the medical drugs for parasites. And he says, strangely, things have changed in the last few years, where the conventional medical pharmaceutical drugs used for parasites are no longer working, that the parasites are all developing persistent chronic forms. Many of them are similar to Lyme, persistent Lyme disease, hiding in the tissues. They're not visible in the poop or in the lungs on X-ray or with the gastroscopy or sigmoidoscopy. You can see them because they're microscopically small. They're adapted. You can find, if Asapi found tapeworm DNA in biofilm, in tissues, and tapeworms, are 12 feet long, and this is like microscopically small in biofilm. The same bug, they're that flexible, and so. In this article, at the end, they speculated and said, if you can combine the medical drugs with time-proven herbal antiparasitics, we have a much, much higher chance of lastingly succeeding in parasite treatment. And I have to say that also in my office, we're increasingly failing on the parasite front. We know from other researchers that are seriously looking at this. I have a friend in Berlin who is a top world parasitologist. He says there's a clear increase in growth and persistence of parasites in areas that have the highest density of electrosmog. So it's really adjacent to the first issue, that our immune system can no longer contain these creatures because of the immune suppression caused by the EMF exposures that we have.
Wow. So let's talk a little about aluminum and glyphosate. I know those are two of the more significant toxins that you've discussed in the last few years. What are the best ways to support detoxification of each?
So the medical detox for aluminum is the drug desferal or desferoxamine. It's a fairly well-tolerated drug. We never had trouble with it. Can be given IV or sub-Q. Usually a shot once a week. The original research on Alzheimer's was done with this drug from Kruk, a physiologist in Canada, who gave desferal once a week for a year and a half. We very often do that with our patients with brain fog and other brain-related symptoms that we are associating with aluminum toxicity. And the amazing thing with that is that people with persistent Lyme often become treatable and successes the moment we add the aluminum detox in. So the natural detox for aluminum is largely done with silica and citric acid. So this is the bottle of water, with a little bit of lemon juice in it, goes a long way. But we use different herbs that are high in silica. Cilantro is one of them, and horsetail is the other one. And we've created a tincture that we have at the Sophia Health Institute. It's called AL Detox. That we had the advice of one of the leading herbalists to put that together, and that works fantastic because it also removes aluminum from the brain. There is a concoction, a synergistic cocktail of things in it. And so briefly about the glyphosate. Glyphosate is a chelator, amongst other things. Glyphosate destroys the microbiome in our gut. It's probably not in itself dangerous to our human cells, but it destroys the microbiome. The pathways, Shikimaki pathway is only in the microbes that we have, but not in our cells. So that's why it was FDA approved. Of course, it doesn't matter what happens to the microbes in our gut. But the funny thing is that it's a chelator, so it binds pretty much every precious mineral in our gut and prevents its absorption, with one exception. When it binds to aluminum, it facilitates the absorption of aluminum, and aluminum and glyphosate make a firm complex that has one target in the brain, and that's the pineal gland. And we find that this complex is probably the most common cause of insomnia. We have this huge wave of insomnia. Yes, the electrosmog is the other necessary ingredient, but it's the perfect storm. That glyphosate aluminum complex in the pineal gland calcifies the pineal gland. You can no longer make melatonin, and everything spins downwards from there. So in terms of detox, to detox glyphosate, you have to start with detoxing aluminum. Most of the glyphosate from the brain comes out when you pull out the aluminum, because they're attached to each other. But freely circulating glyphosate comes wonderfully out with sauna therapy or oil pulling, to chew on sunflower oil for about 20 minutes every morning. That's Dr. Karak's oil pulling treatment. So the entire blood volume circulates to the oral mucosa several times in 20 minutes, and the oil in the mouth extracts from the blood oil-soluble toxins. And then the rest is sauna therapy. Mild temperature every day is very, very effective in getting the glyphosate out that is not bound to aluminum. That's pretty much all I can say here. There's 1,000 other tricks, but those are the main ones.
Great. I'm a huge fan of oil pulling as well, so I think that's definitely a powerful tool. What role do viruses play in chronic illness, both in terms of the Epstein-Barr, HHV6, and those types of herpes viruses, but also the potential of retroviruses? And then maybe more just theoretically, what's the purpose of viruses in the broader context? Why are they here, and what can we do to fortify our defenses against them?
Mm-hmm. In the last few years, been friends with one of what I consider leading virologists. And the truth is that nobody really knows. for sure. I know there is the psychic guys that say everything is Epstein-Barr and everything else comes from that. What's the chicken and what's the egg? So we thought as a working theory for many years that the viruses are the primary injury and then everything else follows. I'm not so sure anymore. First of all, in terms of viral treatments, we are very limited. Medicine is still very, very behind. There's over 2,000 human pathogen viruses, and all of them really need different types of treatments. So that's number one. This is, aside from the retroviruses, I know Judy Mikovits, and everybody should read her work. She's a brilliant, maybe the most brilliant person in that field. She has discovered, that we are basically born with a number of retroviruses deeply embedded in our DNA, and they can be unleashed under the environmental influences that we have right now. The main one being the microwave and the toxicity from the herbicides. However, her treatment suggestions is using the different AIDS drugs. We've tried that and we have not seen the results. And I have also not seen the results of that psychic guy that says everything is Epstein-Barr. Okay, great. It makes sense to people that do it. They have a placebo effect for a while, but then they all relapse. What I believe in is that Borrelia, Bartonella, and Babesia, and Rickettsia, and Ehrlichia are the primary offending agents. And I tell you why. We developed in our office a new way of testing for Lyme disease and the co-infections, and that is using ultrasound on the areas like the brain. In a brain fog, we put ultrasound on the brain in a very specific way. Then we collect the blood or the urine and use DNA-based testing for the microbes. And we find in every one of our patients at least 3 or 4 of these infections, people that were negative on the Western blot for years. And everybody says, well, really it wasn't Lyme, your fatigue really is Epstein-Barr and HHV6 because that's still testing. But the moment we do this test, we show you still have the active bacterial infections. Other people have been diagnosed. No, it can't be that. It must be mold because mold is still, Shoemaker's mold things are still testing. People are sick. They do the mold treatment. They don't get better. They do the viral treatment. They don't get better. And then we make our diagnosis and put them back on our Lyme treatment and they get well. And so my clinical experience is clearly Lyme and co-infections are the chicken, and the viruses come on board as a secondary strike. And the viruses have become so popular because the smaller a creature is in our system, the easier it is to diagnose it. So medical diagnostic is fantastic. It's fantastic for viruses. That's why everybody thinks they have Epstein-Barr, and they do. And that must be the cause of the illness because they can see it in the lab. And it can't be Lyme because we couldn't see it in the lab. But since we turned the lab testing around, and I think you should mention the article, that we just published in the American Journal of Immunology, where we show that very clearly. And we had, out of the first 150 patients that we tested with the provoked PCR test, we had 2 patients that did not test positive for Lyme. 2 out of 150. Now, what are the chances of that?
Wow. That's amazing. So in terms of the treatment for Lyme, then, let's talk a little bit about that. What is your latest approach for treating the Lyme organisms themselves?
Okay. So first of all, it was for us important that we use ART testing, autonomic response testing, that allows us to actually localize where the Lyme is. And so first rule of the day, Lyme doesn't live in the blood. Lyme and co-infections live in the tissues. They live maybe in a joint, but not the other joint. They live in this part of the brain, but not in that part of the brain. They're highly compartmentalized. And there's a joke when something lives in the brain that you look in the blood to find it. Yeah, it's like if you lost your house key in the garden and you look in your car for it, you won't find it. And so medicine has been completely less than retarded in terms of developing tests. And so that's number one. And so the issue with successful treatment is to get the drug to the tissue where the bugs are. This is referred to in medicine as drug uptake. And so the biggest breakthrough we had, and this is published in this paper, is that with ART we can find out where the bugs are, and then we can use ultrasound in specific ways to open access to the area to get the drugs to go to the place where the bugs are. And that has allowed us to greatly reduce the number of items that we need to get a Lyme patient well, and to eliminate everything that's toxic and actually use with very, very non-toxic ingredients to get the Lyme patient well. And so I designed this Lyme cocktail that BioPure has. It has a number of liposomally prepared herbs in it. And then we use hyaluronic acid. Hyaluronic acid teases the microbes out of their hiding places in the mitochondria, in the cells, in biofilm, to come out and look for this food source. And then we use also cistus tincture or cistus tea, which is a profound biofilm breaker or biofilm softener, and a profound anti-Borrelia herb that's published, has a very, very high borreliocidal index. And so we're combining those three things. So people take this cocktail 4 times a day. They take a squirt of hyaluronic acid sublingually 4 times a day, and they drink 6 to 8 cups of cistus tea, which tastes really nice, a day. That's the medical part. But then we're combining that with biophysics to use either ultrasound or a new infrared device to open access to the areas, to the ponds, to the hiding places, the sanctuaries where the bugs are hiding. We also use Dr. Omura's hand acupressure or acupuncture to open those reservoirs. And with that, we're succeeding. The only limit with that is our typical American Lyme patient. When I tell a Swiss Lyme patient, you need to do this acupressure 4 times a day, and you need to use this device twice a day on the stellate ganglion. The Swiss patient, I have to call after 6 months and say, listen, you can stop now. The American patient already after 2 days is not doing it. And so we have problems with compliance when we're asking people that they need to be involved in the treatment, and that you cannot fix Lyme disease with orally taken medicines or intravenously taken medicines alone, that it needs to be combined with the proper type of biophysics.
It's nice how simplified this has gotten over the years. It definitely used to be much more complex. I certainly like the BioPure cocktail. It tastes quite nice. And it's a really easy way to get the antimicrobials in. So do you think that eradication of every Lyme-related organism is possible? Is that even the goal of treatment? Do you find that people need ongoing maintenance for the long term? And do you generally see that with the provoked urine PCR, do you generally see that the bugs ultimately stop showing up, or will that just be a continued issue that we'll see those in the body?
Yeah, the 2 patients that I mentioned that were negative in the PCR were both patients that were very high before. One of the patients was me. And so all I did is follow my own protocol, once we had that figured out, which took, that 30 years to get there. It wasn't something that came overnight. And so, no, the important thing for everyone to know is that the symptoms that a patient has are always caused by the patient's immune responses to the microbes and to the toxins in the tissue. And so the goal of a good Lyme treatment is one word, and that's called immune tolerance. Yeah, that we're finding a balance of a minimum of the bugs in the system that are well contained by the immune system, but not where the immune system is trashing around and slashing the cells, murdering everything in the system that smells a little bit distantly like Lyme disease. That's usually our typical Lyme patient, where the immune system is way overreactive. Certain aspects of it are overreactive, and other aspects are underreactive. And so what that requires is what is referred to as immune modulation. And the wonderful thing with the BioPure cocktail is that the herbs are very carefully selected, that all of them have strong immune modulating effects and mild microbial, antimicrobial effects. So the focus of the whole cocktail, and that's why Scott, when we use ART, well, many patients only test like for 5 drops twice a day. And the patient said, we have a whole host of patients now that have been on 5 years of IV antibiotics with the PICC lines and the staph infection, everything that comes with it. And then I tell them, okay, you start with 5 drops twice a day. And the patient looks at me and says, well, Dr. Klinghardt, come on, stop joking. What do you think that's going to do? Well, I say, well, we make a deal. Give me 3 months. And if you're still laughing at me in 3 months, then I, whatever, but if you are significantly better in 3 months, you owe me. So far I won all these bets with it. That has to do with the herbs are so immune modulating. And, quite honestly, I know, the low dose immunotherapy, overall, we've been disappointed, in our patient clientele with our results. One could argue, well, maybe we're not doing it right. I think we are doing it right, but it's just when you see these end-stage Lyme patients that have been sick for 20, 30 years and the systems have been messed up with all the medical drugs they've had, the low-dose immunotherapy, we have partial successes, yes, we do. But we haven't seen the miracles. I have seen miracles with the other protocol. And so we combine things. We do the low-dose immunotherapy on everybody, and I love it. Whatever piece it's adding to our patient is wonderful, but as a standalone treatment, it has failed in our office.
Very interesting. So one of the new areas that I'm really interested in researching and exploring is the whole mast cell activation syndrome. And I'm wondering if you have thoughts on that, how you approach it. It seems like people that are dealing with Lyme and mold and parasites and all the things that we've talked about, probably many of them have some mast cell and histamine issues. And I'm almost kind of seeing this now as another spectrum of sorts, that we end up somewhere on that spectrum, maybe some more impacted than others. But any comments on mast cell activation syndrome?
Yeah, well, first of all, it's important, so mast cells are white blood cells that have a certain job, and they're high in heparin and histamine, so they can release both. And also, they're highly involved in keeping the blood-brain barrier functional. And they're very, very much involved in the particular aspects of immunity of the nervous system. The nervous system has its own type of immune system. So mast cells on their own are very, very important players in our system. And so in the recent years, because again, every time there is a lab test available, everybody gets a diagnosis. So because histamine is now easy to test in the blood, when every time people have elevated histamine levels, they get the diagnosis of mast cell dysfunction, whatever the modern names are. And I'm suspecting it's a hype that will come and go, but I'm reserving my opinion. We know, for example, that people with KPU, and you and me were also probably in the US the two experts here on KPU, people with KPU in general have low histamine levels, but get severe allergic reactions when the histamine level rises. And it's a relative rise of histamine from the ground level to wherever it rises to that creates an allergic reaction, not the absolute level of histamine. And so when people have chronically high histamine levels, it indicates, of course, an immune activation. And there is a wonderful immune lab in Berlin, my hometown in Germany, Volker von Baer, who has dedicated the last few years in examining Lyme disease. And he really finds every type of immune dysregulation now in Lyme patients. And some of them have chronic elevations of histamine that then leads down a certain way, but in other ones it's TNF alpha that's up, in other ones it's simply the white blood cells overall are elevated, or the monocytes are elevated, or the macrophages are elevated. Yes, so every Lyme patient has their own particular individual way of elevating aspects of the immune system, but the real cause of that is that certain parts of the immune system are under functioning, and then the other parts are trying to compensate for it. If that part of the army is asleep, then this part of the army upregulates the weaponry. And so my hunch is with the mast cell dysfunction, we're going to find that is a compensation for something else that's missing. And in this lab, they do this fantastic test. They take the T cells of the patient and expose them to dilutions of the medicines that we're using, like let's say a mushroom extract or an herb that we're hoping will treat it, and can tell exactly from the reaction which item will work for the patient to fix the defect in the immune system. So let me sum this up. So when we look at mastocytosis or mast cell overfunctioning mast cells, it's, in my opinion, the wrong place to look at. They're making up for something else that's underfunctioning. And the moment we find that and fix that, the mast cells kind of calm down and stop secreting histamine in excessive amounts and all that. That's sort of at least my prediction for it. But, Christine in my office, Dr. Schaffner, she's tracking the issue now, talking to the different researchers involved or so. And I may change my mind on this in the future, but I doubt it.
Very good. Very good. Why is small intestinal bacterial overgrowth becoming such a big issue in the past few years? What do you think's changed that's causing more bacteria in the small intestine? And is there a specific treatment approach that you use?
Well, I think the SIBO has become so predominant because about 4 or 5 years ago, a lab test was developed, the breath test. And whenever there is a lab test, then people find the illness that matches it. And then, of course, the pharmaceutical industry developed a non-absorbable antibiotic, Xifaxan, that works for it. And so whenever the pharmaceutical when there is a lab test that points specifically towards a drug that Big Pharma has developed, then everybody is encouraged, every gastroenterologist, to test for it. And so what we find with the treatment, however, and I'll be honest with you, we probably must have tried 100 people. Okay, they do the diet, which is a very counterintuitive diet that deprives people of a lot of trace minerals and trace nutrients that they need. And you give the Xifaxan, people do fantastic for about 10 days after the end of treatment, and then every one of our patients relapses, and then they need it again, and this time it only works for 5 days, and then the third time it doesn't work at all. So our long-term successes have been very low. People love when they are on the Xifaxan, because they're feeling a lot better. The pressure on the belly is down. They sense relief, and so it gives the false impression that this is a viable treatment. It is not a long-term treatment where we've seen long-term successes. Skipping all avocados for all future also hasn't helped. So people that stay on the SIBO diet have developed serious other new symptoms that it didn't have before. They may not be bloated anymore, but now they get joint pains, muscle aches, insomnia, and other things down the road. So in this office, we've been disappointed with it, and I think it's a hyped up thing right now because it serves some special interests, and of course the short-term results are fantastic, and we use it still to give people a break so they can experience themselves without the bloated upper belly. But I'm not a fan of it. It is just another sign of that the microbiome in the gut is dysfunctional, is dysregulated more often than not. And this is the next paper Ruggiero and I will write. In all the SIBO cases that we have, we found a swollen vagus nerve, and with ultrasound you can visualize that, a swollen dysfunctional vagus nerve. And the moment we do the other interventions that normalize the vagus nerve, the SIBO goes away. Wow. And so we know that already. And some of our patients, have the vagus nerve is infected with Bartonella. It's very common. The celiac plexus very commonly harbors the same Lyme-related microbes that the brain does. And so by treating that, we also get hold of it. And, there's a new probiotic, the spore biotic, where we've had some amazing results, and people that had like already 5 goes with the Xifaxan and the SIBO diet, and they take one of those pills twice a day, and after 3 days the SIBO is gone and they feel fantastic. So there is definitely will be other non-pharmaceutical options that will be better, but again, I don't want to discourage people from going down that way, but I'm very, very suspicious because I know all the literature comes from Big Brother and only appeared after they found a drug that matches the condition, and suddenly everybody has this condition. I'm very suspicious.
Very good. And for those people listening, the probiotic that Dr. Klinghardt is referring to is called Megaspore Biotic. That's the one that potentially is helpful for some people with SIBO. So 2 of the biggest issues that people complain about, as you well know, are fatigue and brain fog. And so any comments on what you see kind of as the pattern of underlying causes for these, and then where's the goal in terms of getting people's energy and brains back?
So the honest answer is, of course, there is as many causes of brain fog and fatigue as we've ever discussed, and of course the immediate anatomical or physiological problem is the inflammation in the brain, the encephalopathy, the low-grade encephalopathy. That's why chronic fatigue is now referred to as ME. The E stands for encephalopathy. That is actually inflammation of the substance of the brain, not the meninges, but the actual substance of the brain, because that's been shown. And so whenever the body is inflamed somewhere, we know there is activity of the immune system trying to clean something up. And there's something that the immune system doesn't clean up 98 out of 100 times is infectious material, is microbes. So any chronic fatigue case that we've ever had and that was ever cured from chronic fatigue was through antimicrobial strategies. Now, antimicrobial strategies always means stripping the toxic floor from underneath the bugs and then dealing with the bugs and getting them out, and finding ways of getting the drug into the brain is a bit of an art. We do that now with the ultrasound facilitated drug uptake technique. And and chronic fatigue was always believed to be viral, but simply because the blood tests that are available for viruses are excellent. I can do an IgG, IgM on herpes type 6 and CMV, and it's positive, and therefore, of course, I think, and then I do a Western blot on Lyme, and it's negative, and I say, well, it's not Lyme, it's viral. Well, guess what? With our new test, the Provoke PCR test, we can treat the patient until there is no more Epstein-Barr, no more herpes type 6, but the Bartonella still shows up in the brain, the Babesia still shows up in the brain, and the patient's fatigue doesn't lift until those 2 are gone. And so my point here, I've tried to make very clear, to not be deceived by the lab work. The lab work can only test what it's testing for, and negative lab work no longer means it's really negative. ART testing has been the best predictor. I know you are a master at it, one of the few people really in the country that has mastered the technique. Well, you are, and you'll find, of course, I know you're finding the same things. And so when it comes to insomnia, the most common cause of insomnia is the viral component of the chronic infections, which I consider most of the time secondary to the bacterial infection. We know that mold toxins play a big role into that. I don't want to poo-poo the whole mold theory as much as I have sometimes, but for me also the mold sensitivity that we find, the HLA relationship, the dreaded type. Well, we've seen many dreaded types that were never ill. The moment you add Bartonella or Babesia in the equation, the dreaded type becomes the dreaded type. That was not the dreaded type after the mold exposures, but only Babesia plus Bartonella plus Borrelia, and then the mold hits really hard. And so the mold should be included in the treatment. But with insomnia, I could go on for hours giving you the different scenarios. One thing that's been overlooked is the typical wake up at 3 o'clock at night that Lyme patients have actually is hypoglycemia. So if you give people a lot of chromium before they go to bed, they actually won't wake up at 3 o'clock. So it wasn't the Lyme alone, it's Lyme causing hypoglycemia, because Lyme is hungry, so it eats at night. And when it eats your food resources in the brain gives you a signal, eat a banana or whatever, or take your chromium before the night. It stabilizes the whole thing. So, the electrosmog, the electric environment at night is a huge issue with that. But for me, maybe one last thing that you haven't asked, but I'm going to answer it, is the mitochondrial illnesses. I think the field is very, very misled. There was an article at least 15 years ago that shows in mitochondrial illness, chronic fatigue, the component that the mitochondria themselves are infected with rickettsia and ehrlichia was at the time found in virtually everyone with chronic fatigue. And that is still the same, because with the PCR testing, we find that the more fatigued you are, the more likely you are to have ehrlichia and rickettsia in your system. And the long-term treatment for the fatigue should be to get the bugs out of the mitochondria, which you do with our treatment. The short-term treatment, yes, you can do intravenous NAD, or you can do acetyl L-carnitine, which we really haven't seen work, or you can do all the B vitamins we really haven't seen work, but it's very popular right now. In our chronic Lyme patients, the severe ones, that won't work, because in the severe Lyme patients from the immune suppression, they have parasites. The moment you give them acetyl L-carnitine and B vitamins, you feed the parasites. The patient gets worse.
I remember also that you had mentioned before that aluminum was one of the other things that can significantly impact the mitochondria as well. So that detoxification strategy.
Yeah, there's a lab in England that uses electron microscopy. And we had the blood there of numerous patients with chronic fatigue, and all of them had high levels of aluminum in the mitochondria.
So let's do a couple of quick rapid fire questions here and just get your thoughts on a few things before we start winding down over the next several minutes. So in your patients, what percentage would you say have some parasites that require treatment?
I would say about 80% of my patients have detectable parasites that we see, and out of those, about half of those require treatment.
Okay. And how about dental cavitations?
Dental cavitations is now 100%. So, and we know already I've been doing this for 42 years. I know that people that never had cavitations, they got Lyme, and 3 or 4 years later into Lyme disease, they had cavitations. I know it's a preferred living place for some of the co-infections is in the posterior lower jaw and the wisdom tooth extraction site. and they grow there and set up housekeeping and because nobody looks for Lyme disease, nobody finds it, but if you do, you find Lyme, Bartonella, Babesia in the cavitations, and that's near 100%. And unfortunately, in most of our patients, the cavitations need to be addressed to get the patient well. And that's often what we found, actually, why that is that when the bugs are active in there, they control from there the drug uptake in the brain. So we find people with chronic fatigue, we give them our Lyme cocktail, it goes everywhere in the body except the brain until we attend to the cavitations, and then it does. So it seems to be almost like the cavitation area is the gatekeeper to the brain. And it's quite astounding what we find there.
Very, very interesting. Any new insights on what the ropeworm is? Is it a parasite or a complex biofilm community of lots of different organisms?
Yeah, I think the latter.
Okay, very good. Let's talk a little bit about copper toxicity. I've seen some practitioners that say it's very common. I've heard others, some that have studied closely with you, that have said they don't often see copper toxicity. So how significant is copper toxicity in the chronic Lyme patient?
Well, first of all, there really is no good objective test. It's the plasma level of ceruloplasmin. There is some indicators, as good as ferritin with iron. It can parallel the tissue level of copper, but it may not. The typical thing that we find in most chronic Lyme patients is trouble when we look at the neurotransmitters. The first neurotransmitter goes down in Lyme is dopamine. That's your drive, your forward drive, your power, your personal sense of personal power, getting things done. Yeah, the Lyme patient doesn't have that because their dopamine level in the brain goes down. And the rate limiting mineral in the dopamine production in the prefrontal cortex is copper. And so by bringing copper to the area, we see dramatic improvements in their psychological presentation and in their ability to handle their life. So I personally think it's a serious issue. Now, on the opposite end, when we have a cancer patient, we know one of the main foods for cancer cells is copper and iron. And one of the strategies that we learned from Paul Anderson in treating chronic cancer is to drive copper levels down, severely down. We use a molybdenum compound for that to deplete people of copper. But the literature or the findings that are true for aggressive cancers do not apply for a patient who has got chronic fatigue, who is in bed because he's copper deficient. And so I test every patient with ART on copper, and we find a good number of patients that need copper, and they do significantly better when we put them on it. At least we have usually I do 6-week cycles where we put them on it, we see how they're doing, then we take them off it. So it's an on-off thing with copper. And I would not believe that our nutrition is now more copper toxic than it was 50 years ago.
So it sounds like in a Lyme patient that it's more commonly the case that people benefit from copper, not that they're copper toxic.
That's correct.
Okay.
Maybe one last thing, sort of what happens when people have chronic inflammation. Iron and copper get displaced from the intracellular environment to the extracellular environment, where we do not need iron and copper. And most people measure iron and copper in there where it's not needed. And if it's high there, they think you're toxic, which you're not, because the cells are starved of it. So it's a strange world. You have to look in the tissue that actually needs it. So that the copper level that is relevant is the intracellular red cell copper level. And in our Lyme patients, it's much, much more common that level is too low.
So you are very well known as well in the world of autism and have done a lot working with kids. Is there anything unique about your approach to treating an autistic child as compared to all of the things we've talked about thus far?
The amazing discovery that Amy Dirksen and I did around the year 2000 was that autism in most cases is Lyme disease acquired in the womb from an asymptomatic mother. That was a revolutionary discovery. There's several studies that confirm that, but it hasn't made, ever since I lectured on that, the autism community is treating me like an alien and has never invited me again to lecture for them. But my autism treatment is focused on diagnosing with the proper medical test Lyme disease and treating it. And I really have to say that there is not much difference in how I treat an adult with chronic fatigue caused by Lyme disease and a 5-year-old with autism. It's a very, very closely related thing, just those differences. And in the autism community, it's difficult to get things into the kids, so we use more rectal enemas or suppositories or actually injections. Most autistic kids prefer to be injected with something rather than taken orally. So there is the management of the kids is different, but we have in general worldwide fantastic results with moms and dads following my lead on that, by bringing in the focus on treating chronic persistent Lyme disease and co-infections has been far more successful than the raw biomedical approach, leaving that out. And again, just to say that, this is good for my ego to say that here, sort of since I started lecturing on autism being that you need to look at Lyme disease, the Lyme community has avoided me and the autism community has avoided me to lecture for them. But it's still the truth and it works.
Very good. Very good. Do you see very many people with chronic Lyme where the mental, emotional factors play an insignificant role?
No.
No, that's what I thought as well. And let's talk just briefly about diet. You have in the past talked about some patients need animal protein in order to really mount a full recovery. Is that still the case, or do most people do better with vegetarian-leaning diets?
Well, the truth is, in the 80s, when it wasn't Peter Diadamo, whoever came, Barry Sears, whatever, somebody came out with a high-protein diet, and I said, oh, fantastic, that's me. And until then, I was pretty well contained with my Lyme disease, and I went on a high-protein diet, and I crashed really badly. And so I'm always been very, very suspicious of the high-protein diet, or even have used it as a diagnostic tool. But what turns out is this, biochemically speaking, when you eat animal protein, which this was, animal protein can, through different pathways, still be converted to sugars. The digestion of protein is quite difficult. It starts in the mouth, and then you need the stomach acid, and then you need the bile juice, and you need the gallbladder enzyme, the pancreatic enzymes. It's a complicated process before you actually get to have amino acids, which is what you absorb. And then the liver is reconstituting those back to proteins. And this is a long way that requires a lot of enzyme systems to work, which most Lyme patients do not have. And so what happens when you actually eat a high-protein diet, you most likely end up growing parasites. And your parasites that were kind of marginally starved for the last 40 years suddenly get these half broken down proteins that they can use for because the amino acid absorption is pretty quick after the pancreatic duct comes in, after common bile duct comes into the gut. And if the proteins, the meat is not completely digested, it travels further down where the parasites live and feeds them. And so our approach has shifted quite dramatically in the last 3 years. So first of all, most of our Lyme patients do better on a vegetarian diet. That's number one. But they need to have a good source, not of protein, but of amino acids. Yeah, that's a mistake I made, because proteins require the whole machinery to work, which most of our chronic patients don't have. And so we use now amino acid pills. I like Amino Care from Dr. Brzezinski. There's a product called My Aminos, or SON. We give high doses of amino acid pills for a while. We even avoid the shakes, made from goat whey or whey products. It's still protein that still needs to be processed quite heavily. So the sicker our patients are, the more we rely on giving them actual amino acids rather than protein, plus a decent vegetarian diet. And the sicker people are neurologically, the more we're tweaking that into the direction of a ketogenic diet. In fact, we're measuring now the ketones in the blood to get to measurable levels of ketones in the blood, and that has been fantastic. Ketones are brain food, and so ketones cannot be converted to sugars and feed the parasites or feed the Borrelia, feed the Bartonella. All these things all the creatures are dependent on, fatty acids to a degree, but only fatty acids in context with the high carbohydrate consumption. You take the carbohydrates away, you're really starving the bugs and you're starving the parasites. And the best way to do that is a ketogenic diet, but the protein source should not be what we refer to as protein, but should be pure amino acids that bypass the regular digestive processes and get absorbed very rapidly just past the stomach and cannot feed the parasites. And so this is a new way of starving parasites. And I forgot to say with the parasites, the new thing in the literature is to kill parasites to increase omega-6 fatty acids. And there goes the myth of all the omega-3 oriented last 20 years. You need ghee and other sources of omega-6 oils. It kills parasites on its own. Yet the larval stages are very, very vulnerable to that. Yeah, and remember, I forgot to say that with KPU is another aspect of KPU. KPU patients are losing omega-6 fatty acids, and that needs to be replaced. So we're tweaking the ketogenic diet quite heavily to include ghee and other omega-6s for a while. And nothing should be forever. This is why people are really, really sick. And then, so the sicker they are, the more they get a ketogenic diet with us, but not with the common recommended protein, but we give them pure amino acids for the easy absorption. And then the healthier they get, they can start including some protein that they can then break down, and eventually they should go back to the diet that's very close to their ancestral diet. The Indian people that I have should go back to eat chapatis and samosas, and the Germans that I have should go back to eat schnitzel and sauerkraut. And the Americans, you go back to whatever you ate when you were a child, or whatever your grandmother gave you. And that is usually what your microbiome is programmed to process.
Very good, thank you. What are your favorite, or maybe your top tool right now for restoring the microbiome?
Well, I have to be careful what I say. There's some things that we do here that I do not want to disclose. I do believe that the fermented foods are definitely for the patient at a certain stage of recovery. When people can tolerate fermented food, it is certainly the best way to get from moderate recovery to full recovery and to stay healthy. However, people that are very sick do not tolerate fermented foods. So right now we use the Bravo yogurt as one of my favorite tools from Dr. Ruggiero. there is a complete dairy-free version that's available as of today. I like the dairy version, because really, like, if you're not freaked out about it, but the milk proteins get fermented, and what you end up, there is no milk protein left. However, some people are so highly sensitive to other things in the milk that they still can take it. But the Bravo yogurt, that's something you ferment, then you have for 2 weeks, you have this yogurt that you eat a certain amount every day, the Bravo suppository. And what we do with ART, we very carefully look at what foods are stressing your system, but then also what foods are working like a medicine for you. And we give more of the foods that work like a medicine for you and less of the foods that are causing stress. And unfortunately, there is no good blood test or poop test that we found that can replace that. So we use ART testing, and it's a fantastic tool. It's time consuming. It will take an hour to go somebody's food program. It's very, very important when you do any form of energetic testing that you don't test food in a glass vial, but the food needs to be prepared exactly the same way you would be eating it, and then that form it should be tested. That's why all the lab testing fails, really, to predict it, because when you test a serum that's been made from diluting wheat, what they usually use, they use the wheat grain, grind it down, dilute it a few times, and then they're testing your blood against that. But you're not eating wheat grain. The wheat is either fried or fermented or put in a pancake. And in that form, it changes its chemical composition. And that's what you're eating. And you cannot predict that based on the blood test that uses some kind of strange serum dilution of some grain that was picked somewhere else on the planet. So But with ART testing, and that you're one of the few people who does that, we can test, the patient brings in the actual food that they plan to eat, and we test that. And it's quite amazing that some foods they eat are true healing tools for them, and other things are really, really bad.
So a few last questions before we wrap up in the next few minutes. I want to get you off to your dinner. Is alkaline water a hit or a miss?
No, I have to watch out for the legalities. Now, the following thing has been reported from people that are smarter than me. When you have alkaline water with a pH of 9, the moment it touches your tongue, it reverts back to a pH of 7 or 7.2, because the total number of carriers of the alkalinity, there's a few molecules that are needed to change the pH paper. That's not enough to make a difference in your overall thing. However, the same machine that prepares the alkaline water also restores the certain electric properties that the water molecules have, and that is very valuable. And so the alkaline water machines probably contribute to the health of a lot of people, but definitely not because it's alkaline, but because there's other properties in the water, the exclusion zone water, that we work so much with now recently from Jerry Pollack's research. There's other properties that the water gains by electrifying it, putting it through the process that makes the water more bioabsorbable and biologically more usable for our system. But if you want to alkalinize a system because somebody is medically too acidic, it is not sufficient.
Very good. And with bee venom therapy, do you find that the injectable venom is best, or live bees? Does that work better?
Live bees work best. There's definitely my personal, you probably know that I use bee venom therapy on myself for 20 years, but I use the injectable bee venom because I can mix it with procaine, and then the bee venom therapy is near completely painless, wonderful. And so, however, in desperate cases, people with very severe, people paralyzed from Bartonella, it's very common. certain sections of the spinal cord, where the transmission just completely fails of the nerve impulses, I would advise to use live bees. And the most elegant method is really the traditional Japanese method, the precursor of acupuncture, where they actually take a tweezer and pluck out the stinger of the bee and then use the same stinger on maybe 10, 15 points along a particular meridian or pain area. And then it becomes very doable. If you only have like 1/15 of what's in one stinger in one spot, the pain is bearable. If you use the bee and let the bee sting you in certain places, when you get the entire delivery of one stinger in there, it's just on the long run unbearable, the pain, even where people really say I'd rather die than do this again. So this all said, the bee venom that we're using is milked from the bees without damaging the bee. It doesn't kill the bee. The bees recover after 2 days of extracting the venom from them. All of them, not just some, but the bees absolutely survive. And so I use the bee venom from my Ximix, which is clean, it's fantastic. I mix it with procaine and then do segmental therapy over areas in the body that need it. And it is a wonderful treatment for Lyme and co-infections.
Where do you fall these days on stem cells? Are you finding that a significant intervention for patients or not so much?
We've had over the years probably 15, 20 patients that went down that road. We have one patient that had significant improvement with it, a young woman, but she had to go to India for 2 months, $40,000, and she had to return after a 4-month interval to do it again, and that worked. It really transformed her life. I have 2 patients that died very shortly after stem cell therapy, one from a stroke, the other one from another sudden event that was unexpected. So that now this is, these were severe cases that probably had other problems or so, but I like fat stem cells and bone marrow stem cells for pain management, for the odd shoulder or so. But I think the other options, the PRP, the ozone injections in the joints, the prolotherapy, we can take things so far with milder methods that I'm not enthusiastic yet about it. But severe cases, young people that have been in bed for many years and nothing has worked, absolutely, yes, they should have a trial of stem cell therapy. But one stem cell injection will not do it. This will take a course of number of stem cell injections, from their fat, the bone marrow, or donor stem cells. And it's more involved. They need to be on some sort of immunosuppressive therapy for at least a year after the stem cells, if they're umbilical cord from other donors. So it's really more involved than we thought it was. But the cases that I know of that recovered from chronic severe neurological disease or Lyme disease, it was more involved than what meets the eye. It wasn't just going somewhere and having 1 or 2 shots and coming home and being well. We just have not seen that, not in our patient population.
Right. What is the most important thing you do on a daily basis for your own health?
Well, I exercise in the morning. I invented my own exercise. I have a particular CD I'd made for my brain. It's brain music that, I had my EEG taken, and then the flaws in it are corrected by tinkering with music. It's called Neuroactive CD. That's a German researcher. I put that on. I get on a bicycle and set the resistance pretty high, and then I use 2 weights. And while I'm bicycling, I do my weights and I listen to the music. And then sort of halfway through, I do my what I consider emotional releases. I scream, I yell, I punch, I do. but I only do that for 20 minutes. I think that's the most significant thing. Twice a week, I do venom injections. And I take my Lyme cocktail, with the 3 ingredients, the cocktail, the hyaluronic acid, and the citrus tea. I do take niacin. That I got some genetic problems in my fatty acids, and that really has been wonderful. And I take some methylated folate. I mentioned that before. It helps me sleep, and it helps me in many other ways. And that's it pretty much.
And I'm guessing you also take liposomal melatonin.
Every night I take liposomal melatonin to go to sleep.
Very good. Thank you, Dr. Klinghardt, for sharing your wisdom with us today. I mentioned in the intro that I have so much gratitude for you and the work that you do. My life is certainly entirely different because of you and your work, and so I thank you very, very much. Thank you for taking the time to be here with us today. I appreciate it.
I love you, Scott, as a co-fellow researcher, practitioner, and as a friend. Thank you.
Thank you.
Bye, Scott.
See you very soon. Bye-bye.
Bye.
Thanks for listening to today's show. I hope you enjoyed it as much as I did. For more information on today's guest, visit the Sophia Health Institute website at sophiahi.com. Information on the Ruggiero-Klinghardt protocol that Dr. Klinghardt discussed in this talk is available at betterhealthguy.link/RK protocol.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.